I didn't think men were allowed to be depressed. I knew how I felt inside, and I felt less than. And I didn't want anyone else to see that about me, and didn't have any hope that I could go forward and be where I'm at today. I'm so much happier now that I can share my thoughts, my emotions, and I do it without shame. I'm Mark. I live in Woodstock, Georgia with my wife, Lisa, and our 3 cats. My grand dog, Blaze, is my pride and joy. I'm a degreed chemical engineer. I work for a mining and materials company. I grew up in Middle Tennessee in an extremely rural area. Depression in my generation and where I grew up, you stopped feeling sorry for yourself. Men do not talk about it. We definitely don't deal with it, and we sure don't suffer from it in public. I didn't have any motivation to do the simplest things like get out of bed, get dressed, get ready for work, spend time with the family, spend time socially. It was miserable. I was at a point in my life where I'd given up on being happy. My wife, Lisa, she held a mirror up in front of my face and said, "This is who you are. This is who you are today. Are you happy with that?" And I wasn't. My primary care physician, he looked at me, listened to what I was telling him, and he said, "My friend, you're suffering from depression." So when I got the diagnosis, I was in disbelief. It started to crack my armor of thinking that I'm this strong, impenetrable, invulnerable person. And so he started explaining to me depression and how it manifests itself and what it looks like. He prescribed me some oral antidepressant medications, and that began the roller coaster ride of success, failure, success, failure. So I just got to a point where I was tired of the roller coaster. I started seeing a therapist, and I didn't understand it when she used this term, but I was her definition of treatment-resistant depression. And it was at that point that I started to understand that there are other options to the traditional oral medications for depression. My therapist told me that there's treatment. It's called Spravato, and my doctor prescribed Spravato for my treatment-resistant depression. My doctor told me that Spravato was something you did periodically versus every day, and there's a clinic 15 minutes from your house.
Spravato is the only FDA-approved nasal spray taken with or without an oral antidepressant for adults with treatment-resistant depression. Spravato is not for use as a medicine to prevent or relieve pain, anesthetic, and it is not for use in children. It is not known if Spravato is safe and effective for use in preventing suicide or in reducing suicidal thoughts or actions. Spravato is not for use in place of hospitalization if your healthcare provider determines that hospitalization is needed, even if improvement is experienced after the first dose of Spravato. Spravato can cause serious side effects, including sleepiness, fainting, dizziness, spinning sensation, anxiety, breathing problems, or feeling disconnected from yourself, your thoughts, feelings, space, and time, dissociation. Your healthcare provider will monitor you for at least 2 hours after taking Spravato. Please see additional important safety information later in this video.
After as little as 2 treatments, I started to feel results. It just made me feel relaxed for the first time in years. And when I say relaxed, just comfortable. Being in a situation with other people, being at work. I know how it makes me feel. I know what I'm benefiting from it. And I can manage the bumps and bruises in life better now. I flipped the script on depression in that more of my days are happy and joyful. It's easy for me to interact with people now. I look forward to being social. I look forward to being with my family and friends. I look forward to new things. And it's almost like a blanket was lifted off of me, and all of a sudden I weigh 60 pounds less. I can't believe I'm the same person. When I wake up in the morning, I don't wake up and say, "Oh God, what have I got to do today?" I wake up and say, "What do I get to do today?"
Important safety information. What is Spravato, esketamine C3 nasal spray? Spravato is a prescription medicine used with or without an antidepressant taken by mouth to treat Adults with treatment-resistant depression, TRD. Spravato is not for use as a medicine to prevent or relieve pain, anesthetic. It is not known if Spravato is safe or effective as an anesthetic medicine. It is not known if Spravato is safe and effective for use in preventing suicide or in reducing suicidal thoughts or actions. Spravato is not for use in place of hospitalization if your healthcare provider determines that hospitalization is needed, even if improvement is experienced after the first dose of Spravato. It is not known if Spravato is safe and effective in children. Important safety information. What is the most important information I should know about Spravato? Spravato can cause serious side effects, including sedation, dissociation, and respiratory depression. Spravato may cause sleepiness, sedation, fainting, dizziness, spinning sensation, anxiety, or feeling disconnected from yourself, your thoughts, feelings, space and time, dissociation, and breathing problems, respiratory depression, and respiratory arrest. Tell your healthcare provider right away if you feel like you cannot stay awake or if you feel like you are going to pass out. Your healthcare provider must monitor you for serious side effects for at least 2 hours after taking Spravato. Your healthcare provider will decide when you are ready to leave the healthcare setting. Abuse and misuse. There is a risk for abuse and misuse with Spravato, which may lead to physical and psychological dependence. Your healthcare provider should check you for signs of abuse, misuse, and dependence before and during treatment. Tell your healthcare provider if you have ever abused or been dependent on alcohol, prescription medicines, or street drugs. Your healthcare provider can tell you more about the differences between physical and psychological dependence in drug addiction. Spravato Risk Evaluation and Mitigation Strategy, REMS. Because of the risks for sedation, dissociation, respiratory depression, and abuse and misuse, Spravato is only available through a restricted program called the Spravato Risk Evaluation and Mitigation Strategy, REMS program. Spravato can only be administered at healthcare settings certified in the Spravato REMS program. Patients treated in outpatient healthcare settings, such as medical offices and clinics, must be enrolled in the program. Increased risk of suicidal thoughts and actions. Antidepressant medicines may increase suicidal thoughts and actions in some people 24 years of age and younger, especially within the first few months of treatment or when the dose is changed. Spravato is not for use in children. Depression and other serious mental illnesses are the most important causes of suicidal thoughts and actions. Some people may have a higher risk of having suicidal thoughts or actions. These include people who have or have a family history of depression or a history of suicidal thoughts or actions. How can I watch for and try to prevent suicidal thoughts and actions in myself or a family member? Pay close attention to any changes, especially sudden changes, in mood, behavior, thoughts, or feelings, or if you develop suicidal thoughts or actions. Tell your healthcare provider right away if you have any new or sudden changes in mood, behavior, thoughts, or feelings, or if you develop suicidal thoughts or actions. Keep all follow-up visits with your healthcare provider as scheduled. Call your healthcare provider between visits as needed, especially if you have concerns about symptoms. Tell your healthcare provider or get emergency help right away if you or your family member have any of the following symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying, new or worse depression, feeling very agitated or restless, trouble sleeping, insomnia, acting aggressive, being angry or violent, an extreme increase in activity and talking, mania, suicide attempts, new or worse anxiety, panic attacks, new or worse irritability, acting on dangerous impulses, other unusual changes in behavior or mood. Do not take Spravato if you have blood vessel, aneurysmal vascular disease, including in the brain, chest, abdominal, aorta, arms, and legs. Have an abnormal connection between your veins and arteries, arteriovenous malformation. Have a history of bleeding in the brain. Are allergic to esketamine, ketamine, or any of the other ingredients in Spravato. If you are not sure if you have any of the above conditions, talk to your healthcare provider before taking Spravato. Before you take Spravato, tell your healthcare provider about all of your medical conditions, including if you have heart or brain problems, including high blood pressure, hypertension, slow or fast heartbeats that cause shortness of breath, chest pain, lightheadedness, or fainting, history of heart attack, history of stroke, heart valve disease or heart failure, history of brain injury or any condition where there is increased pressure in the brain, have liver problems, have ever had a condition called psychosis, see, feel, or hear things that are not there, or believe in things that are not true, are pregnant or plan to become pregnant. Spravato may harm your unborn baby. You should not take Spravato if you are pregnant. Tell your healthcare provider right away if you become pregnant during treatment with Spravato. If you are able to become pregnant, talk to your healthcare provider about methods to prevent pregnancy during treatment with Spravato. There is a pregnancy registry for women who are exposed to Spravato during pregnancy. The purpose of the registry is to collect information about the health of women exposed to Spravato and their baby. If you become pregnant during treatment with Spravato, talk to your healthcare provider about registering with the National Pregnancy Registry for Antidepressants at 1-844-405-6185 or online at https://womens.health.org/clinical-and-research-programs/pregnancy registry/antidepressants. Are breastfeeding or plan to breastfeed? Spravato passes into your breast milk. You should not breastfeed during treatment with Spravato. Tell your healthcare provider about all the medicines that you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking Spravato with certain medicine may cause side effects. Especially tell your healthcare provider if you take central nervous system CNS depressants, psychostimulants, or monoamine oxidase inhibitors, MAOIs, medicine. Keep a list of them to show to your healthcare provider and pharmacist when you get a new medicine. How will I take Spravato? You will take Spravato nasal spray yourself under the supervision of a healthcare provider in a healthcare setting. Your healthcare provider will show you how to use the Spravato nasal spray device. Your healthcare provider will tell you how much Spravato you will take and when you will take it. Follow your Spravato treatment schedule exactly as your healthcare provider tells you to. During and after each use of the Spravato nasal spray device, you will be checked by a healthcare provider who will decide when you are ready to leave the healthcare setting. You will need to plan for a caregiver or family member to drive you home after taking Spravato. If you miss a Spravato treatment, your healthcare provider may change your dose and treatment schedule. Some people taking Spravato get nausea and vomiting. You should not eat for at least 2 hours before taking Spravato, and not drink liquids at least 30 minutes before taking Spravato. If you take the nasal corticosteroid or nasal decongestant medicine, take these medicines at least 1 hour before taking Spravato. What should I avoid while taking Spravato? Do not drive, operate machinery, or do anything where you need to be completely alert after taking Spravato. Do not take part in these activities until the next day following a restful sleep. C. What is the most important information I should know about Spravato? What are the possible side effects of Spravato? Spravato may cause serious side effects, including C. What is the most important information I should know about Spravato? Increased blood pressure. Spravato can cause a temporary increase in your blood pressure that may last for about 4 hours after taking a dose. Your healthcare provider will check your blood pressure before taking Spravato and for at least 2 hours after you take Spravato. Tell your healthcare provider right away if you get chest pain, shortness of breath, sudden severe headache, change in vision, or seizures after taking Spravato. Problems with thinking clearly. Tell your healthcare provider if you have problems thinking or remembering. Bladder problems. Tell your healthcare provider if you develop trouble urinating, such as frequent or urgent need to urinate, pain when urinating, or urinating frequently at night. The most common side effects of Spravato include feeling disconnected from yourself, your thoughts, feelings, and things around you, dizziness, nausea, feeling sleepy, spinning sensation, decreased feeling of sensitivity, numbness, feeling anxious, lack of energy, increased blood pressure, vomiting, feeling drunk, headache, feeling very happy or excited. If these common side effects occur, they usually happen right after taking Spravato and go away the same day. These are not all the possible side effects of Spravato. Call your doctor for medical advice about side effects. You may report side effects to Johnson & Johnson at 1-800-526-7736 or to the FDA at 1-800-FDA-1088. Please see full prescribing information, including boxed warnings and medication guide for Spravato, and discuss any questions you may have with your healthcare provider.